Welcome to the HerbWorks podcast featuring Roger Drummer, the formulator at herbworks.com. An educator in the field of nutrition and Chinese herbalism, Roger has a unique ability to keep things simple by taking all the guesswork out of complicated health issues. HerbWorks is committed to helping you improve your health and enhance your life through herbs and common sense.
Roger Drummer here with another HerbWorks podcast. Today's topic is iatrogenic death. And what does that mean? That means death by modern medicine. Right now, iatrogenic death is considered to be the third leading cause of death in America, behind heart disease and cancer. There's an estimated 284,000 people die every year from the effects of Western medicine. Now, that's a lot of people. And let me tell you, that number is probably very, very low compared to the reality of what the number is. I remember when this topic first came up, gosh, it had to be 15, 20 years ago. And there was a nutritional author, Gary Knoll was his name, wrote a bunch of great books on nutrition, amazing guy. And he came out with this article called Death by Medicine. And he talked about iatrogenic death. I had never heard of it. And according to their statistics, it's closer to 1 million. And they said that it was the number one cause of death in America. Now, a lot of people disputed that. But in reality, when you dig into the numbers the way that they were talking about it, it's probably much closer to their number of 1 million than to this number of 284,000. And by the way, this number, 284,000, was a number that was approximate to what was published in the Journal of American Medical Association. It was a peer-reviewed journal article by a doctor who did the research and came up with these numbers. So either way, if it's 284,000 or it's 1 million, that's way too many people to be dying in this country, the most modern country in the entire world, who supposedly has such a great healthcare system, to have that many people die. Now here's some of the numbers, and then I want to get into why I wanted to talk about this in the first place. In fact, maybe I'll go there now. I've been reading the news. You know, I like to read the news. And I read something the other day that just got me thinking, and I couldn't drop the subject. And that was that a football coach for a professional football team dropped dead on Sunday morning. There's no report at this moment as to what he dropped dead from, but it was reported that he went to the hospital on a Thursday, was held overnight and checked out, and released on Friday, told they couldn't find anything, and Sunday morning they found him at home dead. Now, this is someone who makes, I could easily say without knowing, because I know where he worked, and I know the level of quality of the environment that he is in. It's professional sports. He's probably making at least $1 million a year. Can you imagine the health insurance that man had? I can imagine that he had everything, access to anything that he wanted in Western medicine. And he was smart enough to go to a hospital and get checked out. And more than likely, because of his connections, he went to a really good hospital. A really good hospital that sent him home a day later and said he was fine. And then on Sunday, he was dead. This is what got me started on this whole article again. I've been through this whole iatrogenic death thing, and I went through a phase of paying a lot of attention to it. And then, like everything else, it slid kind of to the wayside, and I got involved with other things. But the reality is, that article about that football coach really brought back a lot of issues for me, a lot of personal issues. And I realized how much of this goes on in this country. It's mind-blowing. I have so much personal experience with it, besides reading about this poor guy whose family must just be heartbroken, who seems to have done everything he was supposed to do, and yet he was sent home, basically, and died 2 days later. So how does that happen? How do you not run the test that shows there's something major going on with you? I'm going to guess it's heart disease. And we'll probably find that out in the news. But, that's my guess, just based on the amount of stress he had, that he carried a little extra weight, his age, 56 years old. Gosh, that's a young guy. That is a young guy who should have another 30 years out there doing whatever he wanted to do. So that instance, that thing in the news brought up a family trauma that we all went through 6 months ago. Not even 6 months ago. It happened at the end of April. One of my relatives died in the hospital of heart failure. He had gone into the hospital in February complaining of chest pains. They admitted him. He did a test on his heart. He had all the arteries to his heart were blocked, at least 95%. Ended up in open heart surgery. There was valves blown off of his heart. His heart was so damaged there was nothing they could do to save it. He couldn't even get on the heart transplant list because he was in such bad shape. So he passed away. He passed away in April. They kept him alive for approximately 3 months. So he passed away. Heart failure, total heart failure. The reason this football coach story brought this back up for me was that this relative of mine had actually gone to the hospital 5 months before that, complaining of chest pains and feeling really sick. Did a battery of tests, sent it to a major university who decided he had indigestion, gave him a few pills, and sent him home. So this is my thought. How do you go from indigestion to 5 months later having 95% blockage of every artery going into your heart and having a heart that's completely destroyed and having it fail in the hospital environment no matter with all that emergency care, and then passing away? How does that happen? Your heart cannot block itself up 95% in 5 months. It just doesn't happen. What test was not run? Who didn't look at what to determine he was in trouble 5 months beforehand? You can't tell me he was healthy enough to send home overnight 5 months before, and you wouldn't notice that he's in this bad a shape now?
This podcast is brought to you by Herbworks, specializing in stress and brain essentials. Check out Roger's other articles and videos at herbworks.com. While you're there, take a look at our natural herbal-based product line for energy, stress, immunity, and sleep. Now back to Roger.
There's something wrong with how we diagnose things and what test. Maybe it's because they didn't run certain tests. Maybe it's because insurance doesn't allow you to run certain tests. But it would seem to me a simple scan of your carotid arteries and your heart would be able to tell anybody how much blockage there is at any time. It's a simple test. You know why I know it's a simple test? Because I get postcards in the mail all the time advertising that they're coming by with a van and I can go down to the grocery store and have the test done for $120. I've had the test done at a doctor's office, by the way. It takes less than a half an hour. They just scan your chest. What is so hard about doing that? Did that happen in either one of these cases? I have no idea. I wasn't there physically. But this bothers me. The other day, I was reading, just 3 days ago, I was reading the newspaper. Okay, I lied. It was on the internet, but it was a newspaper printed on the internet, so I can kind of say that. And there was a report in there from USA Today who did an undercover operation, and found out that there are over 500,000 women injured in childbirth every year in the United States. Let me repeat that. 500,000 women injured during childbirth every year in the United States. 700 of those women die. And you know what they said about in that study? They said that over half of it was easily preventable. These are things that are all happening because someone's not paying attention to basic issues during birth. And those issues were just monitoring their blood pressure and measuring how much blood loss there was. Those are just basic issues of any surgery. And believe me, childbirth has become a surgical event in most hospitals. So their recommendation was just by paying attention, you could save 250,000 lives. Or I take that back. You could save 350,000 lives and have 250,000 women who did not become injured during childbirth. That's mind-blowing statistics in a country like America. Listen to this study. I want to read you something. This study was unbelievable to me. This was also printed in the Journal of American Medical Association. And they were rating the United States against all these other countries and how they paired up and at what position with all these industrial countries. They came in at certain parameters for healthcare. And they came in around 12th, 13th place in all of these, which isn't too bad considering. So they came in number 13 for low birth weight percentages, 13th for neonatal mortality and infant mortality overall, 11th for post-neonatal mortality, 12th for life expectancy at 1 year for males, 11th for females, 12th at 15 years of age for males, and 10th at 15 years for females. Now, you might think that 13th place is not bad overall, looking at the world, but this was a study done that involved 13 countries, the 13 most industrialized modern countries in the world. And the best we could do on any of them was 11th. That's just sad. I hate this. It's just sad. Some of the numbers, 12,000 unnecessary deaths during surgery. Wow. 80,000 infections at the hospital. 106,000 people died from adverse effects of medication. You would think that this has to be made up, and I would almost think it was made up, unless I had all these experiences myself. My relative that had the incredible bad experience with his heart, he passed away. I had an incredibly bad experience that came back to mind when, well, wait a minute, maybe it wasn't a really bad experience. It seemed like a bad experience, but like all bad experiences, it had a lot of amazing experiences happen within it at the same time. Isn't that what life's kind of about? You have these experiences that seem like it's the worst thing in the world, and then all of a sudden the greatest thing in the world happens. And this is kind of what my experience was. And I look back at that whole episode in my life as a huge miracle. In fact, it happened with my youngest daughter, who's 13 now. And we call her the miracle baby all the time. And this is, I'm only telling you this story because it fits right in to this topic of 106,000 people dying from adverse effects of medication. So my daughter was one of the people that got exposed in 2006 to the E. coli that was in spinach. She was one of, it was just a handful of people in the country, I think it was 20 or less, who ended up with hemolytic uremic syndrome, which means your kidneys are failing due to E. coli infection. Your red blood cells get destroyed, and to the point to where all your organs liquefy and basically you die. That's what hemolytic uremic syndrome does to a human being. So nobody knew what was going on with my daughter for 4 or 5 days. It was a miracle that we even made it to a hospital that could recognize what was going on. When I researched this later, after she had been in the hospital for about 6 or 7 days, when I got on the internet to research it, the only websites I could find that had children her age on it contained the obituaries of all the children that had her exact thing. Nobody on that website lived past 3 days. She didn't even get to a hospital before then. And so, anyway, we get into the hospital, and we had an amazing doctor. We were in Toledo, Ohio. We had an amazing doctor who was trained in Syria, of all places. He was from Damascus. He was Muslim, in case you're wondering about that. And this guy was the only child kidney specialist in Northwest Ohio. And he was amazing because he came in, knew what was going on right away. You have to put a stent, or what they call it, a stunt, in my daughter in case they have to do kidney dialysis, in case they have to do blood transfusions, all these different things. So he puts that in right away. And then he interviewed my wife and I, which was so fascinating to me, that he wanted to know what we did for a living and what we ate. And after he did that, and I found this out from him later, we looked so healthy and were so different from his normal patients that he made a decision not to put my daughter, who at the time was approximately 17 or 16 months old, he decided not to put her on dialysis, which was a normal method of operation at the time for anybody that comes in as sick as she was with hemolytic uremic syndrome. So he made this decision based on the fact that we ate so well that he thought our child, because she was breastfed, because she ate organic food, that we took care of her so well, had some life force to her that was going to carry her through this event, and he wanted to hold off on the dialysis. And we went right along with him. He seemed to know what he was doing. And so we didn't know at the time how profound a decision that was. And it turns out, I'll make this really quick, it turns out on the 9th day of laying there in this environment, of just battling it herself without any dialysis. She had 5 blood transfusions. On the evening or afternoon of the 9th day, her blood markers changed, her kidney marker changed, and he said she's going to come out of it. She's going to make it. So we were in intensive care, sleeping on the floor for those 9 days, and spent another 2 or 3 days in that unit. We had the room set up. We had Buddhist chanting music going on, and meditations and singing, and every nurse on that floor wanted to come in our room and hang out. In fact, whenever they had to come in and do the test, they just hung out for 5 or 10 minutes extra because they just loved it in there. But I'm not telling you this story. Well, there is a good part of this story for all of you to know that I will refer back to. But the main thing I wanted to tell you about this story was that not only was our main doctor, his name was Terabishi, not only was our main doctor amazing, and that he did this just unbelievable thing with my daughter. And it's unbelievable because if she would have done dialysis, she would have been a candidate for a kidney transplant by the time she was right about now, 13 or 14, going through puberty. That's when most of those kids that are on kidney dialysis younger, at that young age, will have to have a kidney transplant. And it also sets them up, even with that, for a huge proportion of these people end up with high blood pressure, diabetes, all these different health issues because their kidneys are weak, and that's the main battery of power for your entire body. So we avoided all of that. It's just an amazing experience. And this is why I said you can have an amazing experience in the middle of a just god-awful experience, right? So besides that, we had another doctor who was just the doctor of the floor. In other words, he just roamed around that floor checking on everybody. My daughter wasn't his only patient. And that was a teaching school, so he had 5 doctors. It was just like a mother duck with some little ones following him around all the time. They just tailed him everywhere in the hospital. And the first day my daughter was in there, he told me an amazing story, which fits right into this talk. He said him and his wife were on vacation in, I think it was North Carolina. I'm pretty sure. And his wife was a doctor also. And she had contracted some illness which he didn't go into. And they ended up in a hospital, which I won't name, but it's the number 3 medical hospital in the entire United States. It's a very prestigious medical hospital. And so that's where they ended up. And he told me that within a 24-hour period, his wife would have been killed 2 times if he didn't check her chart and look at what they were actually going to give her. Think about that. These are 2 medical doctors in another research hospital who, if the husband wouldn't have checked the chart before they either injected or gave her a medicine, they would have killed her twice because they got it wrong. And he told us this story. And then he looked at us, he goes, I am so anal about everything that goes on this floor. I can guarantee you, nothing will happen to your daughter on this floor as long as she's here. That's a mistake by this hospital. It just won't happen. That's what he said to me. And I thought, wow, and then, years later, I find out about all these different problems that are going on in hospitals. It was quite a revelation, but I never forgot that story. And again, reading this story about this coach, having my other relative go through what they went through, really brought up my daughter's story and coming back. And even about a year ago, when my wife was the main caretaker for her dad, you really realize how important it is, if you're going to the hospital, to almost always take someone with you that can fight for you, or to have somebody that can help you to try and understand things, especially like with my wife's dad. When that person is elderly and having memory issues, they literally don't have a clue of what's going on. You almost have to be there 24 hours a day because of the way that mistakes are made, or they're just not even going to pay attention because somebody's old and they don't think that they need the care because they're going to die anyway. Now, you may think that sounds heartless, but we had that experience. My wife confronted a nurse who basically, she heard her say to another nurse something to the effect that he was going to die anyway, and why were we putting the effort in? And my wife let her know that that's not a decision for the staff to make. Yes, he was in poor health, and he probably is going to pass away in the next few months, but that's a decision that the family makes, not someone who's working in a hospital who's taking care of someone. And so obviously she apologized to her and was profusely, but the reality was that was the comment. And this happens all the time. When I was researching a little bit for this article on iatrogenic death, death by medicine, I came across another researcher's article disputing the facts on Gary Knoll's article about how many people. And one of her comments was mind-blowing to me. She made the comment, well, yes, some of those people died from medicine and from unnecessary surgeries and things, but maybe those were people that were saved a few years before and might have died then, but they got a couple more years of life, and so that seemed to justify it. So I'm thinking, oh, let me see. So I survived an emergency because of modern medicine. So it's okay if the same medical system kills me a couple years later. I couldn't believe that this comment was ever made and put into print. That somehow justifies making a mistake and killing someone. But then anyway, back to this topic and the real reason why I wanted to talk about it today. I wanted to talk about it because I'm a really healthy guy. I pay attention to what I eat. I exercise. I'm in great shape. Well, at least in my mind. But I exercise enough to stay in shape, but not enough to compete in anything. That's how I look at it. I don't compete in anything anyway, so why should I do the extra? But anyway, I'm in good shape. If I had to leave tomorrow and go outside and go hiking, I could walk 10 miles with a little light back on. As long as I had water, bag of nuts, I'm fine. I can go 10 miles. I might not be able to do 10 miles the next day. I might be a little bit sore, but I could go out and hike 10 miles. So there's a level of activity I can easily go out and do and not worry about it and not feel bad. So my point is that even people like me are going to get sick sometime. A couple of years ago, I had cancer. Came out of the blue. And one of the things that helped me survive that was the fact that I was healthy. Now you're probably sitting there going, well, how could you be healthy if you had cancer? Well, I'll tell you, I was in pretty good shape. I ate really well. I had a localized cancer, which today my doctor calls me the miracle guy when I come in because he has never seen anyone ever go from what I had to being cleared of it in less than 2 months without any medical intervention. I never did the whole process that was required in Western medicine to get rid of my cancer. And the cancer never spread anywhere, even though I had a biopsy and they scraped it and released all these stems, cancer circulating tumor cells around my body. My body contained all of that. I've had tests ever since. There's no cancer in my body. It was all contained. It's all gone. Took me a few months of herbal therapy, diet, meditation. It's gone. That's why I say I was actually healthy. Most people don't realize that you can have a localized cancer and it can emit certain enzymes or signals that fool your immune system and it just doesn't recognize it and doesn't work on it. So anyway, I was able to recover from that quite quickly because I was healthy. Same thing with my daughter. My daughter survived E. coli because she was healthier than the normal person. And so now she's someone that won't have a lifelong connection, so to speak, to Western medicine. In other words, she won't need lifelong attention because she avoided having dialysis and having a kidney transplant. Because her parents ate really well, she was fed really well, she was healthy to begin with. And this is the thing that's going to save you when you come up against Western medicine. And I say come up against because this is the funny thing, again, about Western medicine. Western medicine has a lot of amazing stuff in it. And yet there's a lot of stuff that needs fixing and a lot of things that go on that don't make sense. And it has to do with insurance companies running everything, poorly trained people. And this happens to so many people. I was just in an office the other day and a nurse complained to me that she had a health issue. And she was shocked at how hard it was to get quality care. And she worked for a hospital. She said to me she couldn't believe how much she had to fight for her rights as a patient to get quality care. Her whole career has been working at a hospital. So back to my point. My point is you're going to need the medical system sometime. The medical system has a lot of amazing stuff in it. I have met some of the most amazing people working in hospitals. Doctors, nurses, all kinds of practitioners. People you think, if you got to go back, God, I hope I run into them. I hope they're my person again, right? And then I've also run into things where you just wonder, why are they working here, right? So this is just how everything is. It doesn't matter if you're buying a car or you're going down to have surgery. It's just a certain percentage of people shouldn't be in their job. And so you have to be knowledgeable enough to not only know what's going on at all times, to be able to ask for different tests, to be able to really be involved in whatever's going on with you, and maybe take a friend along with you who'll be that advocate and fight for you if something happens and you can't do it. But the other point I really want to make here is that this is one of the reasons why people should take as good a care of themselves as they possibly can. Because someday you're going to have an emergency, and your survival is not going to be totally dependent on the doctor you get or the hospital you're taken to. It's going to be dependent on your own life force, your own internal energy. It's going to be dependent. It might be a car wreck. It might be an emergency surgery. It might be cancer. It might be anything. But your survival is going to be dependent on how much life force or energy you have in your body to withstand the trauma of the event and maybe the trauma of the treatment. And so this is one of the reasons why we eat really well, we take care of ourselves, we don't waste our bodies away, we don't get involved with things that ruin our health, but we support that life force. I didn't know anything about life force and supporting life force until I became an herbal apprentice and studied Chinese herbology. Had amazing experiences. It became my life. And why? Because I had chronic fatigue. I was completely worn out. I couldn't sit down without falling asleep. And I learned about this concept of life force and what they call Jing in Chinese herbology, putting energy back into your glands. And so I got on this path of taking certain herbs and putting stuff back into my body. And you know what? It was like watering a plant that had wilted and fallen over. After about 30 days, all of a sudden, I started to stand up straight. My body started to soak up energy. Things started to progressively change because I was building life force. And then I learned this whole art of how to hold on to life force and not dissipate it. That was a hard one for me to learn because I was still addicted to my excessive exercise with the triathlon training, and I still wanted to do that until I had a little greater awakening that realized I needed to drop that idea. And so, but the reality was, what saved my life then is probably the same thing that saved my life when I had cancer, was that I spent all these years building life force. I ate better food. I took a lot of herbs every single day that build my system up. I want people to experience what it's like to put tonic herbs into your body and have your energy come back, to feel your glandular system come back, and to feel your body making energy out of your food. And all these things are possible when you take a certain amount of tonic herbs, food-grade herbs that put energy back into your system. And really, that's what HerbWorks was all about. It's what it's about, and why it was put together, to give people the chance to experience these things that I experienced. Maybe you're that flower that's wilted and drooping over that needs to rebuild, and that's what the herbs are all about. And so that's my talk for today. That's my kind of warning for the day, is that we have this medical system that is amazingly wonderful and at the same time has all these spots of danger throughout it that you have to be aware of. And so you have to be able to take advantage of the wonders of it and avoid the rest. And the best way to do that, again, is to be aware and to be healthy, to take care of yourself so you can pick and choose when you use something and be present enough to know what you want and what you don't want, and be strong enough to survive challenges and crises when they crop up in your life. Thank you for tuning in today to another HerbWorks podcast. If you want more information, you can go to herbworks.com.